Respectful gestures and patient communication encourages the clients to open up comfortably, setting the foundation for an effective therapeutic relationship. Scenario 2. Unhealthy counseling practice. In contrast, this scenario highlights unprofessional and unwelcoming behavior from the therapist. The therapist exhibits a lack of interest and engagement, failing to greet the client warmly or make them feel acknowledged. Their close body language, dismissive gestures, and indifferent tone contributes to an uncomfortable atmosphere. Rather than creating a safe space, the therapist's impatience and lack of empathy makes it difficult for the client to feel heard or understood. This approach discourages open communication, leaving the client feeling isolated, judged, or hesitant to share their thoughts and emotions. Such behavior undermines the therapeutic process and should be avoided in professional counseling settings. In counseling practice, SOLA is a useful technique that enhances active listening and effective communication between the therapist and the client. It stands for Sit Squarely, which demonstrates full engagement and presence, and Open Posture, which conveys approachability and a non defensive attitude. Leaning slightly forward shows genuine interest in what the client is sharing, while maintaining appropriate eye contact helps build trust and connection without making the client feel uncomfortable. Lastly, being relaxed creates a calm and supportive environment, allowing the client to feel at ease. Together, these elements help foster a strong therapeutic relationship. Here is the demonstration of counseling practice. Scenario 1. Healthy counseling practice. In this scenario, the therapist demonstrates a warm, welcoming, and professional approach. As the client enters a session, the therapist greets them with a positive demeanor, offering a genuine smile and open body language. The therapist acknowledges any signs of discomfort the client may exhibit, creating a safe and supportive environment. Through gentle, reassuring words and attentive listening, the therapist fosters a sense of trust, allowing the client to feel at ease. The therapist's empathetic tone, respectful gestures, and patient communication encourages the clients to open up comfortably, setting the foundation for an effective therapeutic relationship. Scenario 2. Unhealthy counseling practice. In contrast, this scenario highlights unprofessional and unwelcoming behavior from the therapist. The therapist exhibits a lack of interest and engagement, failing to greet the client warmly or make them feel acknowledged. Their close body language, dismissive gestures, and indifferent tone contributes to an uncomfortable atmosphere. Rather than creating a safe space, the therapist's impatience and lack of empathy makes it difficult for the client to feel heard or understood. This approach discourages open communication, leaving the client feeling isolated, judged, or hesitant to share their thoughts and emotions. Such behavior undermines the therapeutic process and should be avoided in professional counseling settings. In counseling practice, SOLA is a useful technique that enhances active listening and effective communication between the therapist and the client. It stands for Sit Squarely, which demonstrates full engagement and presence, and Open Posture, which conveys approachability and a non defensive attitude. Leaning slightly forward shows genuine interest in what the client is sharing, while maintaining appropriate eye contact helps build trust and connection without making the client feel uncomfortable. Lastly, being relaxed creates a calm and supportive environment, allowing the client to feel at ease. Together, these elements help foster a strong therapeutic relationship. Here is the demonstration of counseling practice. Scenario 1. Healthy counseling practice. In this scenario, the therapist demonstrates a warm
Good evening, Jasmine.
Hi, sir. Good evening.
Evening. How are you today?
I'm good, sir. Thank you. How are you?
Good. Very nice. Yeah. Good evening, participants. Welcome. So we have 2 more minutes to go. We start at 6 p.m. Yeah.
All right, sir. Yeah.
Yeah. It's 6 p.m. Welcome, Jasmine, for your presentation.
Yes, sir. So, I'll start off the presentation as of now.
Yes. Yeah.
Okay. Okay. Yesterday we were talking about different attending and listening skills, and we focused on different nuances of every skill that is should be practiced as a therapist and what should be noted while we're talking to the client, do's and don'ts. And we also focused on different non-verbal communication and gestures that as therapists that we need to be attentive to or pay attention to. So today, I want to, give you a little more examples of reflection of feeling because Baleza mentioned that it's important that I tell you about how it can be used differently. So, as we all know, reflection of feelings is as a therapist, from your own words, you try to name the different feelings the client must be going through by kind of paraphrasing what the client is saying, at the same time, naming different feelings. So, I'm going to give you a few examples of that. For example, if the client is coming to you and if the client is telling you there's so much going on and I have a lot happening at home, at work, and even some there are some issues around work as well. I don't know what to do anymore. So how do you respond to the client as a therapist? For example, you could tell your client, it sounds like you're feeling really stressed about what's happening and you're very unsure about how you can handle everything. So this is how you do reflection of feeling. You stay with the feeling rather than getting into the issues what the client is saying. So when you say that, the client sometimes acknowledges the feeling that is being told to you and they build on it. Another example could be um, maybe the client tells you, I just don't think I matter to anyone, and there is nobody there who really cares about me. So when the client comes and tells you this, how do you respond to the client? Maybe you can tell him or her that you're feeling very unimportant and disconnected right now. it feels like nobody really cares or sees the true person that you are. So when you talk about this, the client is able to link the feeling. Okay. So this is how you use reflection of feelings. And for you to use the reflection of feeling, you need to know the basic feelings and the intense feelings. So that's how you use reflection of feelings. And maybe another example could be if your client comes and tells you, like, every time I speak up and people tend to, ignore me, and it's really frustrating for me when people do that. So, as a therapist, how do you respond to the client? You could tell the client, I understand that you're feeling really frustrated and unheard, and and you have a feeling that your voice doesn't matter anymore to people, and different situations gives you this feeling. And you can also ask the client to build up and talk about how he feels or she feels, right? So this is how you use different methodology. This is the way you use reflection of feeling. And there is also called reflection of content. So the difference between the reflection of feeling and the reflection of content is the feeling part, you're focusing only on the feelings, and here you're focusing on the content, just like the name suggests. For example, when you say reflection of content, for example, the client comes and tells you, I have a lot of assignments to do, and this week, and due and plus, I have so much of responsibilities both in the work front and at home. I'm not sure how I'm going to manage this. So when you respond to the client, you could tell the client, it sounds like, you have so much on your plate right now, and with your school and with work and with family. I get that you're kind of unsure about how to balance all of these things. So this is how you use the content. All right. And one more example would be, you know, probably if the client comes and tells you that related to their diet. For example, they tell you that I'm trying to be healthy, I'm trying to eat healthier, and I'm trying to do a lot of exercise. But every time I start, I'm not able to continue. I somehow end up, getting back to my old self. So, how do you use a reflection of content here? You could say that, you've been making a lot of efforts to improve your lifestyle through exercising and other activities, but it's been challenging to manage and maintain those things in the long run, right? So this is how you change the content, and you paraphrase it and you change it accordingly. And you can build on this content if the client shows the agreeableness, or if he shows that he is kind of responding, or she is kind of responding, you can kind of build on this. So this is how you use reflection of feeling and reflection of content. So I guess everybody is clear, and if you still have further doubts or clarifications, you can always, put that as a question to me, and I will be happy to answer. But like I mentioned yesterday, we'll be focusing a lot more on probing, and let's move on to probing part. So the art of probing is usually, you're focusing on asking a lot of questions, and you're making sure that you're asking the right questions at the right time to the client. And it's neither wrong or inadvisable if used sensitively. See, when you use probing, like I mentioned yesterday, it's very, very important that you understand how much probing you want to do. Sometimes when you keep questioning the client, I understand as therapists, you may not have clarity from the content they're giving, and you keep like probing them and you keep asking them a lot of questions. Some people tend to get irritated. You can use a skill of probing in cases where the client is highly resistant and you're not able to get anything out of the client. And the client is showing interest in talking but doesn't know where to talk and how to talk and where to start off with. So during those circumstances, you can use a lot of probing, and it actually helps the client to open up and talk. So that's one thing, about probing. The purpose is to help the client to open up, number one, and number two is to see how they feel and to focus more on the feeling questions, because when you explore on the feeling questions, like I already mentioned, it's the client is able to talk more and build on it. Questioning the clients helps them to express their feelings more. It helps in assisting information. It clarifies causes and reasons for whatever they're feeling or whatever you're trying to address for the client. It encourages the client to be more involved in the counseling session. Using different questions opens up the conversation, leading to more discussions. So these are the reasons as to why we use probing as a technique. And the next one would be type of probing questions. What are the kinds of probing questions that you can ask? So when you ask the client, sometimes it can be open-ended or close-ended questions. It depends on the context that the client is talking to you about. And you can also ask multiple questions. Mind you, when you use multiple questions, not more than 2 or 3 max in the same question. So when you keep adding questions, you're only focusing on your mental process and the thought, and you're not paying attention to, sometimes the question itself can make the client feel clouded in their head. So it's very important that you're very sensitive about combining different questions and see how relevant it can be. So why and where and when and how questions can be asked. Yes or no questions can be asked. Sometimes yes or no questions are asked to clients, usually when the client is excessively talkative. If you find that the client is excessively talkative and you're finding it difficult to stop the client, that's when you tell the client, I'll ask you a few questions. You can just tell me whether it's okay or it's not okay, or whether it's a yes or no, or you can just stop with how you felt about it. So you can keep the question more focused to talkative clients. And even close-ended questions can also help when you're talking to a client who's excessively talkative. And there are clients sometimes you meet, they keep jumping from one topic to another. And as a therapist, it can get confusing for you, because for them in their head, it is very relevant. But for you as a therapist, it's not so relevant. So it is okay for you to stop and pause and ask questions in between. Sometimes when the client is like constantly talking, you can always say, like, is it okay to stop you, and I want to talk about this and get this clarified before we move into the next thing. Is it okay that I stop? So the client will obviously tell you yeah, and you can ask your question and you can get your clarification and then keep going for the next story, whatever they're bringing into you. And suggesting to tell more is the best way of asking probing questions. I'm going to be talking about different, ways that you probe. For example, the technique can be used in 3 different aspects. One is clarification. You ask the client by asking clarification questions. Can you explain this a little more? Or exploratory questions like, what do you think that led to this situation? Or you can ask encouraging and reflection questions. How do you feel about that decision? For example, if the client is constantly talking to you and saying, it's always been like this, I've always, had people backstab me, I've always, felt issues at work, and people always target me. So you can stop the client and ask him or her to tell what are the other circumstances that this has happened, and have they experienced such patterns in their past experiences at work or in their personal life. You can also ask a very focused question as to how they felt and at that point of time, and has it always been the case? Yeah. So when most of the time what happens is when the client is facing a lot of issues, they tend to generalize the situation. So when they tend to generalize the situation, it's very what do you say, it's very difficult for them to rationalize it. So, as a therapist, it's very important that you rationalize for the client by asking probing questions. So, these are the ways that probing questions are usually used. The next would be, summarizing. This would be the last of what we are going to discuss today. The summarization is, like I mentioned yesterday, it's a technique that is used sometimes in between the session and most often, and 90% of the time after the session. So there are certain inclusions to the summarizing part, and I will be talking about that later. Now, what is summarizing? The whole discussion as in when you started off with the session and till you winding up the session. It's very important that you summarize everything and put it in a nutshell and give it to the client, so the client knows how the session went, and not just that he or she knows how the session went, but also it helps the client to process different things that is being told. Because we're sitting for like 45 minutes to 1 hour in every session. And when you do that, the client might be talking about a lot of things, and most of the time, the client is just rattling away. So when you do summarizing, it helps the client to have focus on what was discussed during the session and how that discussion has evolved, right? So this helps, the client also to get a better understanding of what was discussed during the session. So to make sure that the client has understood what is being discussed in the session correctly, to enable them to move to another topic and bring closure. So sometimes the client, when they talk, they don't feel that clarity. So when you do summarizing, it helps them to gain more clarity. And because they have that clarity, it helps them also to bring a closure. So when you don't summarize, what happens is sometimes the client feels unfinished, while you're winding up the session. So it's very important that you summarize every session. It helps to end the counseling session with an understanding and clarity, right? So this is what summarizing is usually used very intentionally. Again, there is this something called intentionality in counseling, right? Reflection of feeling and reflection of content and a few other techniques that we use are very intentional techniques. You use it with a purpose and understanding that this is going to help you and this is going to bring result, and this solves the purpose, right? So when you use summarizing as a technique, it gives closure to the entire session that you've had for 45 minutes to 1 hour. And when you talk about how summarizing helps the therapist, it provides focus for the session, like I mentioned. It brings the focus and it confirms of the client's perceptions, focus on one issue while acknowledging the existence of other issues in the session. So to terminate the session also in a very logical way. So these are the, when you see from the therapist point of view, these are the aspects that we find helpful. Summarizing that helps from the client's perspective is it clarifies what they mean and what they have spoken or what they have said during the sessions. It helps, it helps the client realize that the counselor actually understands their problem and they are on the right track and they kind of get what is being told. Then you have a session and you have a sense of movement and progress. So the client feels that, I brought this issue and there is a sense of progress, and the client, there is a sense of movement to the different stages. So, and it also gives the client a lot of clarity. So this is what we say when we talk about the summarization of the session. So when you talk about different techniques that was being used, we were talking about attending techniques and we were also using the solar and all of that. One second, I'm just going back to the slide. So These are the portions that we've covered so far, which is attending skills, where we focused on different techniques also. And we have listening skills, where we focused on listening and understanding of what is being told, and you're giving the same understanding to the client as well. The reflection of feelings, your different gestures and body languages, and how non-verbal communication is effective, and how focusing on different non-verbal communications actually help you. So when you also talk about non-verbal communication, yesterday I was talking to you about different postures. I was talking to you about how the eye movement and the client's different posture shows whether the client is interested or disinterested, or the way that the client is responding to you, and how you're sensing that response from the client is very important, and how you're aware of your own feelings, and how you don't let those feelings play into different aspects of every progress of the session. So when you talk about probing also, we kind of understand now that probing is a technique that has to be used very sensitively, not over excessively, but little more sensitively. And I was also talking to you about confrontation yesterday, and how confrontation is a very sensitive technique like probing, and how it should be used. And every bit of it, as a therapist, carries a lot of assertiveness. As a therapist, you need to be very assertive to the client. And sometimes, when you feel that things are not working out, or things are not going in progress, sometimes when you feel that the client is just bringing in stories after stories and the client is not getting into the working phase, it's very important that you point it out and you bring the client into focusing phase. And also, when you talk about summarizing, it's very important that you set goals between every session. And setting goals, not every client is focused on setting goals, but they just want to be heard. But even to those clients, it's very important that you have clarity of how the session is going, and the client also shares the same clarity of the session, which is why you're using summarization. Because when you use summarization, the clarity of every session will give you a sense of progress. Not just you, will also help the client to get that direction of how to move into the next phase of counseling session. So with that, we are moving ahead. Now that we have completed the unit 2, I wanted to take this opportunity to help, to just help you with different techniques that can be used differently. And if you have any clarifications or doubts about how to use these techniques, you can always shoot out the question. Now that we've had enough time to, discuss different techniques, I think we can focus more on the application front. And if anybody has any questions, you can ask me. Guys, we spoke about attending, listening, and few other skills after that, like probing and learning about different gestures and different gestures and non-verbal communications. So these are the things that you need to know as a therapist in the attending and listening skills. But in the practical front, when you practice it, it's going to be a little difficult when you try to apply all of this. See, when you practice as a therapist, uh, especially when you start off, you kind of consciously use all of these techniques. For example, when the client is going with the flow, you feel that sense and the need to use a reflection of feeling or reflection of content or paraphrasing or summarizing. And the appropriateness of such usage you have to ask questions to help me understand where you're facing the issues, because I'm sure you must be practicing in the triad, different skills and techniques that you've been taught. And if you're able to raise questions on what are the difficulties you faced and how else attending skills can be used apart from what is being told here, you can ask these questions.
Ms. Jasmine, there is
Yes.
a question in the chat box. Ma'am, can you please give examples for probing a highly resistant client?
Okay. So when a client is very resistant, they are not ready to talk. Most often, you can ask the client about, why he's not, responding. You can clarify with the client by asking questions like, are you sure you're okay? Do you think you need more space and time for you to open up and talk? And if you want to take that space and time for you to open up and talk, I'm willing to give you that time. Right? Also, when you ask, for example, if the client is saying, I'm always upset, and he doesn't talk the next sentence, there's a long pause. You could ask the client, has it been always the case where you feel upset? Or is it now that you're feeling upset? If the client is telling you that at this point of time he's feeling upset, you can always ask the client, what about it is upsetting him? Is it the people around him? Is it the family around is making him feel upset? Or is he feeling forced to come for the counseling session that is making him feel upset? So you can always give him different hints. Different. You can choose different environments to ask him probing questions. See, sometimes when you get resistant clients, no matter how many questions you ask, they will just stop with one word or two words. And when you get a resistant client, it's very important that you don't focus on probing and you focus more on building rapport with the client. Because only when you build rapport with the client, that there is this readiness to respond to you. Otherwise, he has no intention of responding to you and he's just going to keep quiet. So, probing as a technique need not be used all the time. When you feel that there is need to know more about what is being told or said, that is when you ask probing questions.
So there is another question. What about clients who are distracted and cannot focus on studies?
What about?
Clients who are distracted and cannot focus on studying.
Okay. So when the client comes to you, especially a student, when he says that he feels very distracted and he's not able to focus on his studies, it's very important that you explore his environment. You need to understand if there is a problem that is triggering his behavior. See, most often what therapists do is they focus only on the end result, which is I'm not able to focus on my studies, and they give different techniques as to, I'll focus. You can, you have used this method. Have you tried that? Did you do mind mapping? Did you do this? And all of that things. So it's very important that you try to understand the background of the client. If the client may be facing family related issues, the client may be facing peer related issues, or the client might be having learning disability, or the client must be having issues in focusing in class because he might be distracted with other things, or the client is itself might be suffering from ADHD where he finds it difficult to focus. So it's very important that you understand the background instead of just focusing on the presenting problem. When somebody comes blankly presents the problem, I understand, yes, that's a presenting problem for the client. But as a therapist, you need to help the client understand that self awareness is the first level to do anything. So you need to help the client to understand what is triggering and work on that to get your result. Yeah. So I notice there are other questions. Yeah.
So someone is asking, can you suggest some techniques to improve listening skills and understanding in a counseling session?
Listening skills in the counseling session.
Yeah, listening skills and understanding in a counseling session.
Okay. In the counseling session, predominantly what you're doing is listening. As a therapist, supposed to listen a lot more than you talk. At least during the beginning of every session, or when you're slowly trying to establish rapport with people, it is always important that you are not just listening to the client, to the story of the client, but also pay a lot of attention to the facial expressions, their body gestures, and how they're sitting in the session, whether they're tensed or whether they are okay, whether they're too relaxed. All of these things you need to pay attention to. So listening is not just listening to the words of the client, but you're also listening to the different messages that the client is giving non-verbally. So when you use listening as a technique, most often what we tend to do is you focus on the story, that you keep shifting the focus. So what happened, or the clients themselves keep shifting the focus. They don't keep the focus to themselves. They'll be suddenly talking about their mother, suddenly they'll be talking about their brother and how that is being impacting them, and suddenly they'll be talking about how their friend is being impacting, and suddenly they'll be talking about how their college life and their work life is impacting them. So it's very important for you as a therapist to listen. Only when you listen, you will be able to use categorization. When you're able to categorize and bring focus to different aspects of what the client is being told. For example, focus on the client, focus on the environment, focus on the different personal aspects that the client needs to develop. So you should be able to draw all these things in your head, in a form of mapping. That way you will be able to respond better to the client. So these are the different techniques that you use intentionally when you listen to the client. And most often when you're starting off as a therapist, you're that inquisitive to know a lot more of the story, and sometimes that it is possible that you get carried away in the client's story. It is very important that you know where to draw the line. When you get too carried away into the client story, you get over involved in the story and you miss out on the important things that the client is bringing to you. And secondly, when you get too invested into the story, what happens is you tend to lose, focus on actual presenting problem of the client. So it's very important that you understand the background of the client, for which you need to ask basic questions like what the client is doing and what their family does, and what, the Adler's theory, we are going to be talking about the first child, second born, and the last child. So you need to understand the dynamics in the family. So when you understand that, when the client is talking to you, you will be able to relate to different aspects. So your attentive skills and your listening skills can be used appropriately. Okay. Sometimes we tend to focus only on the skills and we are worried about where to use it. When the client is talking, sometimes we are in that sense of urgency to use paraphrasing. Just because you feel the sense of urgency to use the paraphrasing, it doesn't mean the client feels the need to do that. So it's very important that you understand the whole vibe in the room, right? So understanding the whole vibe in the room also helps you to focus on what the client wants from you. So as a therapist, you need to understand that what the client wants is more important than what you want from the session. If the client is not ready to find a solution, if the client is still feeling that compulsiveness to share and talk and vent out, as a therapist, you're not supposed to push the client to do that. You're supposed to excessively use your active and listening skills, attention and listening skills. So you are more focused on, if you're more focused on what you want to show to the client, you will lose focus on what the client wants you to do for you. So it's very important also to ask the client what is expected of you as a as a therapist. How do you how you are expected to help the client? So that will also give you a lot more clarity on what the client expects and what the client came in for. So, not excessively using your attentive and listening skills, but also, to use other modalities is very important. And especially using your different senses is very, very important when you talk to a client. Yeah. So, I hope I answered that question. So, is there any other question for me?
Yeah, there are a couple of more questions.
Mm.
As a budding counselor, how do we maintain rapport with the client?
Huh. That is the initial skill that you will be using, and that skill prolongs until you terminate the session. You begin with rapport and you continue with rapport and you end with rapport. The whole rapport aspect, many times we think that it starts off, and we think we have established the rapport and we don't invest into building or maintaining that rapport. It's very, very important that you get the pulse of the client then and there, even during the session. And even if you have gone for 3 4 sessions, it's very important for you to check whether the rapport is still there or not there. So the rapport building is from the end of the session until you terminate the session. You're going to keep building the rapport. And also, the whole rapport building part, as a therapist, it's very important that you don't do over self disclosure when you build rapport with the client. Most of the time, that happens. Sometimes, when you try to build rapport with the client asks you a lot of questions. And most often, those are personal questions. So, you need to learn to draw the line with your client. In the name of rapport building, you should not get over invested into the client, or you need not allow the client to feel more close to you. Your job is to help the client. Your job is not to build just the rapport and have a good relationship with the client. Yeah. So the rapport building is, of course, it's an important technique, but we need to use it appropriately. Yeah. So the next question. Yeah.
Yes, there is another question regarding the reflection of content. Can you please give more examples, ma'am?
Okay. So when you talk about reflection of content, um, maybe, if the client is coming to you and is telling you that, okay, lately, I've been spending a lot of time with my partner, and because of that, my work and everything is getting affected. And I feel that I have invested into the relationship too much, and I don't know what to do about it. So, how do you use reflection of content here? You probably tell the client that, you seem very concerned about how spending time with your partner has been affecting your entire schedule, and how you're worried that this might cause distance between you and the client if you tend to withdraw. So this is how you use reflection of content. So you draw the content, you process the content, and you give it to them through their eyes in a different perspective. That is how you use reflection of content. Also, a reflection of content can be used, for example, okay. Sometimes the client might come and tell you, my boss is like constantly picking on me at work, and it doesn't matter to him how much ever I invest into getting the work done. He keeps nitpicking on me, and he keeps bombarding me with a lot of things, and overload of work. So, how do you reflect the content to the person? Uh, I understand that you feel that your workload is increasing, And no matter how much efforts you put in, it seems like your boss is not acknowledging your efforts. Yeah. So this is how you reflect the content back to the client. Yeah. I hope I've done justice to that question. It's very hard for me to process what the client would say because we're used to client asking and reflecting, right? So I hope I've answered that question.
Someone has raised their hand. Can you unmute your mic and come with your question? Mohan sir, can you unmute? 25 CP. Let me see who is it. Yes, Jnana Saraswati from Madura College, Tamil Nadu. Can you unmute your mic, ma'am? Could you come on the video, please? Okay. Maybe, Jasmine, you could tell the participants what kind of clients that you meet on a regular basis and what kind of counseling do you give to the public?
So for me, since I'm a relationship therapist and I focus a lot more on couple counseling and couple therapy, I do get a lot of clients as couples, and most often I am using a lot of dynamics into play, and I use Bowen's and systems theory, but just to give me that understanding of differentiation of self or that triangulation, and to understand the different dynamics, I work with a lot of couple. And on the contrary, I work with people, those who come with a sense of urgency, like, with loss of parent, or love affair, or they had a severe breakup, a lot of suicide attempt cases. And I also see a lot of cases with clinical background because I work with different psychiatrists in Trichy. I do get a lot of clients with bipolar disorder, schizophrenia, personality related disorders. But predominantly, I get a lot of people who come with a sense of urgency to get their problem solved. So as a therapist, I'm a CBT therapist, but most often I used a lot of solution focused therapy because when the client is feeling that sense of urgency to resolve their issues, it does help them to gain some direction and focus, at least in the beginning stages. And in Trichy, yes, there are a lot of challenges because people are still not open to come to a therapist, and they don't understand the concept of counseling, which is why I receive a lot of resistant clients, because most often they're forced by their partner to come for therapy, and that willingness to come for therapy is not still yet there as to developed cities like Bangalore and Chennai. There is still a lot of resistance, and there's still a lot of stigma as to why I'm brought for counseling sessions. It is actually very challenging for me to make them understand that going to a therapist need not mean that you have a psychological problem. It is a very normal thing to go to a therapist. You're just going to somebody to get your problems sorted out when you're not able to deal it on your own. So, different types of cases, yes, I deal with a lot of relationship related issues, and predominantly, I work with marital related cases. Yes, I noticed there was a question on the chat box.
Yeah,
I'm not able to see
so
it.
if a client has a doubting issue, continue to imagine that his wife or husband.
Hmm. When the client is coming to you with a presenting problem as to that they have a doubt whether their husband has a marital affair, or it can be anything. you need to first understand whether this is a pattern, whether the client is carrying the pattern of doubt, for which you need to do some amount of exploration on the background of the client. And we need to understand if the client has a reason to believe what is being told. Sometimes the suspicious behavior comes in because of personality related issues, or sometimes related to insecurity. If the client feels insecure about the partner, they are not able to tolerate that the client's husband or a wife is more closer to someone, and they tend to develop some sort of a suspicion. So you need to understand the background, what is creating the suspicion, and whether the client has a proof for suspicion, or whether the client has proof or evidence, or whether the client is just feeling that there could be, and they strongly believe that this could be a reality. Yeah. So I think as therapist you need to get the facts straight from the client for into even begin questioning the client.
So what challenges do the beginning counselors face when applying these micro skills, and how can they overcome them?
Okay. So even when I started practicing as a therapist, while I was talking to the client also, I kind of felt, oh, I should be using this skill. Oh, I should be using this skill. And all the things that I studied constantly kept bombarding in my mind. And it is very normal for everybody to do that. And most often, when you're budding, when you're just starting off, you feel the need to help. And most often, you tend to get over invested into the client. Okay. Or when the client is sharing with you their story, if it is any way associated to you, you tend to go to your own episodes. So that sense of control that you will not have in the beginning stages, and you will not know how to appropriately use this, and you're constantly worried if you're on the right track, which is why it's very important that you take supervision. For any counselor, most often I have noticed people when they, especially when they're starting, they think they are handling it and they assume they're handling everything right, and they tend to continue, causing damage to themselves as well as the client. It's very important when you're starting off. You are under constant supervision. You need to have a supervisor to advise you, to correct you if you're not going on the right track. Sometimes you might feel that you're on the right track, but the client may feel otherwise. It's very important that you constantly check with the client whether you're on the right track. But more than that, as a therapist, it's very important that you go for counseling sessions regularly and you take supervision seriously. Even if you don't find a supervisor, at least you need to have an established peer supervision group, at least within the people that you have studied within class. For example, it's been more than 10 years since I passed out, but I still have my peer supervision group active. Most of the time when we face difficulty with the client, or sometimes we even feel a sense of doubt, we always catch up and we do the proper presentation of the cases. Even though they are our own friends, we don't do it informally. We still have that decorum and we still present the cases. We still give a prognosis diagnosis, and we still maintain that whole the decorum of a peer supervision. When you start off, you feel the compulsion to use everything that you have studied, and also you think you know everything, and you will even when you're talking to normal people like your own cousins and your own people. I have seen many people who do this mistake. They tend to keep giving them advices thinking that you have a lot of experience. You need to understand and acknowledge you just started off, and it's not necessary that you know everything and you got everything right. So avoid or refrain from constantly giving advice to people thinking that you know everything. Okay? There is counseling itself is a big ocean. Even I don't know a lot of things, or even Balaya sir with vast amount of experience. There are possibilities where we also can make mistakes. So it's very important when you start off that you get proper supervision and you keep yourself on checkpoint all the time.
So,
So the client becomes defensive when asked about sensitive topic. What micro skills can be used? Okay. You have to use confrontation. And yes, when you're using confrontation, you're supposed to make sure that your body gesture and all is open and the client does not feel threatened about your question. You need to be very sensitive about the tone and how you're putting that question forward, the sentence structure of the questions, how your assertiveness has to be properly framed, and a little bit of sugarcoat, little bit of minimizing, and you put the question right. It's very, very important as to how you're using different techniques there. When you feel that the client is defensive, it is very, very important for you to bring it as a point of discussion. Okay, you can't go on with the client being defensive. It is very important for you to address it at that point of time. So you have to ask the client for more clarity, or you can ask probing questions also. You can tell how you feel. Self disclosure is important here. You can tell, I've been sensing some amount of defensiveness from your side. Correct me if I'm wrong, but if that is what is going on, I would like to know what is making you feel that way. Asking questions like this would help the client to feel the need to talk. And also, it is very important that you're very sensitive about the structuring of questions. The client should not feel that you're taking the upper hand, right? If the client is, especially with a defensive client, it's always better that you don't make the client feel that you're taking the upper hand as a therapist. And sometimes you have to stay strong with your questions, and your confrontation needs to be strong with defensive clients, otherwise, they'll just shove everything on you back. Okay, I hope I've answered that question.
Participants, your mics are unmuted. I request, who is it? Dr. S. Jnana Saraswati. Yeah, please unmute yourself and ask your question.
Yes, sir. Thank you very much.
Yes, go ahead. Yeah.
Yes, sir.
Sure.
Now
Yeah.
yes, now it is unmuted. Thank you so much for your kind consideration, sir. I'm Dr.
All
S.
right.
Yes, sir. I'm Dr. S. Jnana Saraswati, assistant professor as well as assistant controller in the Majra College. It's a 135 years old college. I'm very happy to attend these classes. I have one question to Dr. Jasmine, ma'am. Ma'am, I have a student who is in undergraduation and she's from a very rural background, and she is being getting married to a drunkard arranged by her parents. And being a mentor, I really want to help that girl, but the girl doesn't come to me as other students, those who were there in the class, they wanted to really help her as she had been crying for one full week. And some of the classes when I went, I used to watch every student's face to see whether they are normal or not. And I could also by myself, before the girls come and tell me, I could see that something is wrong with her. But because of very tight responsibilities, I thought I can talk to her later. But now that it is since 1 week, she's very dull. And when the students came and told me, I just wanted to go to her, but she herself told the other girls not to reveal anything to anybody, and she is undergoing the suffering. I really want to help her heart to heart, this girl. And there are lots of caste, religion, and so many other things are there, as all of us are very much aware that these days it's very difficult to touch the students without their concern. And but being a girl, a child, I really want to help her. So can you please tell me whether I myself can really voluntarily go and take up a counseling? And the point is that her parents from a deep village is really what to say, they can't really understand that someone is really helping her daughter to come out of this. It's a very critical situation, yet I want to help her. Kindly please suggest me how should I go about with it. I unmute my mic.
Okay. So it sounds very, I understand the sense of urgency there, and I also, get where you're coming from. It's just that the girl is not voluntarily coming to you, and you feel that sense of urgency to help her that is coming from deep within. you can't go as a therapist to her and approach her and ask you to come for counseling, because that is not ethically right. The client, if what you can do is you can talk to your friends or whoever's come and told you, you can talk through them. You can tell them to convey to her that somebody is willing to give you that support system that you need. Do you think you're ready to talk about it? If she says no, then you really can't help it. So when you have people like this, see, it most often happens that we are helpless. Okay, we don't know whether we are supposed to step in or you're not supposed to step in. But here, there is a clear sense of boundary. The girl has not come to you directly and told you of her problem, but you have learnt of it. So you may not be able to function as a therapist unless she wants you to take her as a therapist. But what you can do is you can call her separately and you can ask her, or you can tell her, see, I have noticed for the last 1 week that you seem very disturbed. And I have noticed, and it's very visible that you have been crying for all these days. And it's very concerning for me. Do you think you want to talk about it? Or you can give her the scope of space. You can tell her, I understand that you might be going through a lot and you may not be ready to talk about it, but I just want you to know that I'm here in case you want to talk about it, or if you want any help of any sorts. I want to let you know that I'm here and I want to give you that space and I'm willing to give you that help. So that's all you can do. See, as counselors, we are limited to a lot of things. Unless it comes from the client, we can't go openly and do a lot of help that we think we are capable of doing. So, yeah, we do have that limitation. I hope my answer helped you.
Your answer helped me really a lot. It gives me a sense of relief also, even though I wanted to help her. As you rightly said, the urgency is only from my side, and I really appreciate the clarification that you have given me. Thank you so much, ma'am. And thank you, sir.
Is there anybody else that has any doubts? Two people have. Yes.
Ma'am, can I?
Yes.
I'm Bharati from Madurai, ma'am.
Hi, ma'am. Tell me.
Hi, ma'am. Ma'am, as a therapist, what type of client problem are most exhausting to work with, ma'am?
Sexual abuse for me. Like, I find that very exhausting to work with, because when you learn of their experience, as women, most often the sexual abuse case that I get are mostly women. And I've had, in my experience over 10 years, I've had only 2 guys. Apart from that, everything is women. So that feeling of having an unjust society, it does make me feel challenging to work with them because of that intensity of emotions that they share. And to work with those intensity of emotions, it's very emotionally exhausting and it's very physically exhausting. Sometimes as a therapist, there is something called where you feel what the client is feeling. And most of the time I have felt, when I work with deep emotions that are coming, it is physically, I can feel it in my body. Like I shared yesterday with one particular client, I felt that suffocation and I couldn't breathe during the session. I felt so suffocated. And I asked the client, are you feeling suffocated? How is that how you're also feeling? So for me, the most emotion, the deep depth of emotions kind of makes it very challenging for me to work, because I'm a very emotional person and I can connect with emotions very easily. So that's one thing. And secondly, The most challenging thing is, and very exhausting thing is to work with family. When you have families come in for the session, until you build that rapport, when both the couple are fighting during the session or even at home, to make them to feel rationalized itself, it takes away a lot of energy. And to hear some of their arguments and their stories, it does carry a lot of taking away of energy. So those two are very challenging that I felt, in my experience.
Okay, ma'am. Thank you.
Mr. Anto Richard?
Yes, sir. Namaste.
Yes, you can unmute your mic. Go ahead with your question.
Just now I was listening.
Sir, if you're
Madam's,
comfortable, can you switch on your camera?
Okay,
If
madam.
you're comfortable, there's no compulsion.
Okay.
Yes. It's
Okay,
easier
okay,
for me
okay.
to talk to you like that instead of just wildly imagining. Yeah.
Okay, ma'am. One, two. Yes, madam.
Yes, yes.
Just I was listening this question and answer. Sometimes even I feel when we relate to some of the issues, maybe a client or someone who comes for advice or counseling. Now, sometimes it happens that we are overtaken by their emotions and sufferings, what they're suffering actually. Now, how do some tips you have? Any tips where we can declutter or detox ourselves? Because sometimes it's exhausting, no? Listening to different stories, very horrible stories sometimes. How
Yes.
do I get revitalized, then maybe what to say, detox or declutter from those, so I will be energized to attend another person or another client?
Your question itself has all your answers, right?
Oh, no,
So
some
that means
tips,
as a
madam.
therapist, you actually know what you're doing, which is a good thing. So when you face clients like this, you mentioned that you declutter. That is also a technique for you to use, because sometimes things can get overclouded in your mind and you may not be able to think straight. So it's very important that you declutter. All your questions had all the answers that you needed. It's just that you didn't realize. Yeah. So yeah. So when you're able to compartmentalize, it's very easy for you to see things as it is. And it is very important that you're very attentive to what you're feeling. Most of the time, when you're attentive to what you're feeling, it helps to gain solutions to most of your problems, because your feelings are the only things that don't lie. And it's very genuine. If you're able to name your feelings, you will be able to understand what is triggering the feelings. And by understanding what is triggering the feelings, you'll be able to find a better solution. Yeah? Does that make sense?
Yes. So I need to be aware of myself.
Yeah, self-awareness is the key. Even while talking to the client, sometimes you need to come back to yourself with split seconds and understand what's going in your head. And sometimes what happens is when the client is talking to you, you tend to get carried away in your own story that is related to them. So when that happens, it is very important that you pause and come back to that here and now.
Thank you, ma'am. Thank you.
Yes,
Thank you.
Mr. Nanda. Mr. Nanda, kindly unmute your mic. Yes, yeah.
Thank you, sir. Ma'am, I have a question. How do we convince sometimes the students or any other person? Like I work in a college, so many students come to me with their personal problems or with problems in their family which are very sensitive. I'm not a trained counselor, and I just give them like advice that I'm not a trained person. I don't know how to solve your issue. So please go to a counselor. And the moment I say that, they're like, no, we do not want to go to a counselor. And what also happens is I work in Chennai, and sometimes a new attitude has come up in last couple of years where students say that this counseling is a work idea. Counselors can't do anything. And they also go and spread the idea around that, see, this counseling and all is not part of our tradition. This is coming up from the new generation of students. So how do I convince the students or anyone who I know desperately that please go for counseling. We will talk to you
Yeah,
or to
that's
some
very
other
interesting.
faculty. We don't want to go to a counselor.
That's a very interesting question. And I'm trying to understand where that compulsion is coming from. See, if you see, we are limited to certain things. We can't always give people solution to their problems. And even if we are ready to give solutions to their problems, they are not ready to take it. Unless they are ready to receive, the giving doesn't matter. Okay. So that awareness needs to be there, that going for counseling can actually help them to resolve the issues in beautiful ways, and they need to be convinced about it, and it's not your job to go convince them about it. Yeah, you can only tell them, dude, you need counseling, and I think counseling can go into a professional counselor is going to do wonders for you. I think you can benefit out of it. Would you want to just go try and explore the option? If you're not fine with it, you can always discontinue the session, but do you want to at least give it a shot? That's all you can tell the client, or that's all you can tell the student. Maybe what you can also do is to psychoeducate them and tell them, okay, you know, this is what counseling does, and this is what the counselors do, and there are options for you, and these are the options. That's all you can do. Nothing else is in your control. Yeah, I hope I've answered your question.
Yes.
Yes, ma'am. Thank you, ma'am. Thank you.
Amtul, you can unmute your mic and ask your question. Yeah, good.
Good evening.
Hi.
Yes,
So,
ma'am. Yeah.
yes. There is a case. The client has a mild learning disability. He's my student. So, actually, the parents came with this request that they don't want him to write the examination because he is learning disabled. So, what I suggested is, why not to keep a scribe? Because I understand he might have problem in writing. So then they brought a government disability center certificate, and they are like, see, in this also they are showing it is 40% learning disability. So how can you allow my son to write? Just pass him. So because that is against the rules, I cannot tell that okay, just passing is okay because he is in graduation. So what I told is a scribe can work out, and we will give some extra half an hour time to finish his examination. Then another after 1 week they came with a letter that he is also suffering from autism spectrum disorder. But when I inquired from other teachers, his behavior is normal with classmates. He enjoys activities and everything. And here they become agitated that they are coming to me, and I'm able to tell the exact problem, and I'm able to solve it. And they are very agitative. They are like, they don't want to talk to us in the counseling center. They want to directly talk to the principal. So how to handle this type of parents so that they will at least, this is his final year, so that at least he will pass and go and have a graduation with him.
So first you need to understand if this is coming from the parents or it's
Yes,
coming
yes.
from the child.
Both.
You need to first
Actually, the
understand
child,
whether the child is pushing the parents to do all of this.
yes. Sometimes I feel that because he will not tell anything, he will only blame parents. And parents are like, no, my son cannot do it. He's also having autism. I don't know from where they got a report that in that it is stated autism spectrum. But when we are talking about spectrum, it is a very huge thing, because autism, they cannot come even till graduation in a normal educational institutions.
Okay, see,
So, is this the correct
often in
thing when I
India,
told that they can have a scribe for the examination? What more can I do to
can I
convince the
just stop
parents?
you? Can I, if you don't mind, can I just stop you and answer the question first?
Yes,
Because
yes.
when you bombard me with different questions,
Yes,
it
yes,
gets
yes,
very
yes.
difficult for me
No
to,
problem. No
you know.
problem.
So yeah, when you talk about the child with autism, most of the time in India, a lot of disorders are gone and not diagnosed or misdiagnosed. So, and also there is a probability that they went to a person and just got the diagnosis. Most of the time in India, there is no proper structure. So what people do is they just go to a general physician and take treatment. So it's always better to direct the person or the parent to a government doctor who is capable of doing diagnosis. Either he can be a clinical psychologist or a psychiatrist, and you can request for evidence-based report from them for you to process it. Okay. Number two, you can say no because this is an institution, and having an institution and practicing an institution, you have certain limitations, and it's okay to be okay with such limitations. You can't always have their way, and they always can't have their way in an institution. So there is a decorum that is being maintained there in the institution, and you don't have to satisfy them all the time. No, that's not our job. We are not working there to satisfy them. We are working and we have certain roles and responsibilities that is prescribed for us. And if he is going to get the certificate to get the scribe, you have given him the best option. There is nothing more you can do. If the parent wants more, then you have to take it to the management, and the management has to take the decision. You have very limited control over that.
Thank you so much.
Did I answer your question?
Yes, yes, yes. Thank you so much.
Yeah.
Yes.
We take the next question from Samarpita Roy. Ma'am, kindly unmute your mic and come on with your question.
Thank you so much. Thank you so much, sir. Ma'am, actually, I have two questions to you, ma'am. One is, you mentioned that you are an emotional person, and so am I. So that question is coming from there. Usually, in the professional setup, in the institutions, academic institutions, we are asked not to get, emotionally, attached to the students too much, or So, is it a good thing or a bad thing to be emotional and in the academic setup? And corresponding to that, the second question is, we also need to act as mentors to the students. And one of the participants also mentioned that, as mentors, a lot of issues come to us. The students come up with a lot of problems and issues. So how much of it can we kind of tackle with our limited abilities? And if we have to, become a counselor or become a mentor to them in that respect, what can we do? How can we develop that skill, counseling skill, in that manner? So, ma'am.
Okay, the second part of the question is still a little unclear to me. So what I will do is I will just answer the first part of your question, and I'll come back to the second part of the question if that's okay with you.
Sure, sure, ma'am. Sure.
Yeah. So the first part is you mentioned that you're an emotional person. That is
Yes,
who you are. And it's okay for you to be an emotional person, but you need to know that you should not let your emotions play when you're actually sitting with the client, because somebody is investing their time and their emotion and their story into you, and is coming to you with a purpose. So you need to have that emotion regulation and emotion balance. So as a therapist, it's very important that you understand what you are, and you need to understand what you should be in the session and what you can be in the session. So when I say that I'm an emotionally driven person, it's not that when the client cries, I also feel emotional and I cry.
Did the link come?
Can the others mute the mic, please? It's getting very distracting for me.
1 minute, Sarah.
Yeah. So when you say that you are emotion person, there is you tend to empathize, and sometimes you tend to over empathize. So it's very important to you to know where to draw the line and where to draw the boundary, so that you know. Okay, so that you know that that you're using that appropriateness there. So the second part of your question was something related to being a mentor and how much you can help. Am I right? Is that what you were talking about?
Yes, ma'am. Yes.
Online, please?
Yes, ma'am.
Yes. So you were talking about being a mentor and how much can you help? Okay, especially when you're working in colleges. Number one is you have too many students under you. and your
True.
focus is kind of distorted. Like it's all over the place. And it's okay for you to be that way. Unless somebody comes to you one to one, you can't really help them on a holistic front.
True.
That's something that we all need to face as mentors when you work in an institution. And yes, you need to have basic skills of counseling. What I mean by basic skills of counseling is that not by jumping at solutions and giving the clients, most of the time what we do is, Tambi, you do this pa, you do that pa, this will try this will work out for you, you do this, you do that. That's how we end up giving solutions and recommendations. That's not what is expected. Sometimes people just want to be heard.
Yes.
It's very important that you understand what is the need for coming to you. Once you focus on the need, you will be able to get things right. Yeah.
Thank you so much, ma'am.
Yeah.
Thank you so much, ma'am. It was helpful, ma'am. But just one clarification: basic skills of counseling. Does that also involve some kind of a training or some kind of a course that we need to do?
The course and the training only helps you to gain understanding of how counseling can be used and different skills of counseling can be used appropriately. But only with experience you will learn. Just going through a course doesn't make you a therapist. You have to learn it through experience and over time with supervision, which is why I emphasized on supervision and guidance. Because most people think they can just finish the course and come and practice. You're risking somebody else.
True, true.
So it's very important that you, at least in the first 3 years of your profession, it's very important to go for continuous supervision.
Thank you so much, ma'am. Thank you.
Yeah.
So we had a lot of questions and a lot of interactions, Jasmine. So thank you very much. I invite Ms. Shama to propose the word of thanks. Ms. Shama, yes, yeah. Unmute your mic, please.
Good evening, all. On behalf of the organizers and the participants of the certificate course on counseling skills, I would like to extend a heartfelt thank you to our wonderful speaker, Ms. Jasmine, for the insightful talk that we had the privilege to witness today. Ma'am, the clarity with which you articulated your ideas, coupled with the real-time experience you shared, truly brought the essence of counseling skills. It wasn't just informative, but also highly engaging as you made complex concepts relatable and easy to understand. Your passion and expertise were evident in every word and in the charisma with which you navigated the flow of talk. Thank you, ma'am. Thank you so much.
I would like to also thank Dr. Balaya for giving me this opportunity to address all of you. It was great to take classes again, and thank you, sir, for the opportunity.
Yes, you're welcome. Dear participants, today one of you called me and asked me, sir, looks like you are very serious about the attendance and do it very professionally. And this is the first time, that I have attended many certificate courses, and this is the first time that I am attending a certificate course that's so systematic, and you are very serious about the program. I said, yes, I am, and we are serious about the program, and we do it systematically. And I find some of the participants are asking questions about the attendance. Well, 36 hours are mandatory, meaning we have 25 hours for online classes and 20 hours for offline classes. We give the leverage for those people who cannot attend the offline classes, the 20 hours, but then we cannot give the leverage of absenting for too many online classes, because this program is a certified program. It's a 3 credit program, and which is passed by the Board of Studies and it is passed by the university. We go by the rules and regulations of the universities. Therefore, we have already, in the beginning itself, in the brochure we have maintained, the required hours, 36 hours are mandatory. So, and the assignments, I suppose most of you have sent the assignments to the email ID that I have sent to you. Some of them have asked me for exceptions because you're busy with some assignments in your colleges. No problem. Yeah, but kindly do the assignments and submit the assignments because we have to provide all the evidences to provide you the certificates. That's all I have to say. And for today, thank you, Jasmine. Thank you, ma'am Samarpita Roy. And ma'am Samarpita Roy, you were the first ones to register for this program. Thank you very much. I think you have attended other programs of the college sorts that I have organized here. Thank you very much here. So we call it a day. Thank you very much.
Sir, I have a question, sir.
Yeah,
sir, since I am in Hyderabad, I cannot attend the offline session, sir.
Yes,
but
yeah,
that will be like 25 hours only. So would that be hindering my kind of?
No, not at all, not at all. Therefore, ma'am, we have sent the recording of the live classes, offline classes. So kindly go through them, and we have already posted it in the YouTube, in our YouTube channel. Kindly go through them. We suppose that you go through the offline class materials, and you help yourself. So we trust that you go through the offline class materials. Also, we will be posting more video materials, video contents in our YouTube channel. Till now, we have made it enlisted, but then we will be keeping it open maybe after 2-3 days. Yeah. Okay. So regarding the offline classes, we understand and we give you the leverage and we give you the freedom to go through the live classes and get benefited by that.
But the attendance won't be a problem for attending the final exam.
No, it won't be a problem. Not at all. Not at all. Yes, not at all. Yeah.
Hello, sir. Hello, one question. I think yesterday you have not sent the Google Sheet. So is it okay?
Yes.
Yesterday you have not sent the Google Sheet for attendance. Okay. So just we put our name and our code number. Is it enough or we have to do something?
What is it? What is it? Could you come again?
Yes. Yesterday you have not sent the Google Sheet for attendance.
Yeah, we send every day, Professor.
But
we
yesterday
send every day.
I couldn't
every
find
day, 2-3 times we send. We start from 5 p.m. onwards, and we can keep on sending for 3 times at least.
Chat is going on in the last hour. I have seen nothing is there, so I thought you have not sent it.
No. We will ask. We'll ask. Miss Krishiba, could you post the Google form link again?
For yesterday, not today. Yesterday.
Yesterday we won't be able to do it, sir.
No, that's what I'm asking. Today is
yes,
okay.
but yesterday we posted. Yeah. So if you could not, if you attended the class and if you could not fill the Google form, kindly send a message to my WhatsApp phone number. We will take care of it. Yeah.
That's it. Okay. Thank you, sir. Thank you.
Yeah, welcome.
Sir, hello, sir. Namaste. Sir.
Namaste.
Hello, sir. Sir, Anto. Sir, that exam on March 1st will be evenings. When will the exam? How we are going to write?
We will let you know, sir. We will let you know, sir.
Okay. Yes.
We will let you know. If March 1st is not appropriate, probably we can have it later also.
Okay. Yes. Thank you.
All right. Yeah. We will continue.